So this is fatty rump steak, and there's my Bulletproof coffee, and this is coarse sea salt. I've just have it in the Himalayan salt grinder, but it's coarse sea salt. I prefer Kalahari salt. To answer your question about the Bulletproof coffee and cholesterol connection, if you have high cholesterol, should you not drink Bulletproof coffee? I don't think that you should avoid ingesting butter, because Bulletproof coffee is made of butter, or butter is in it, or cream. The fat part of dairy is butter and cream, and that is actually very healthy. The sugar part, the milk sugars, is actually what you should try to avoid. That's why I suggest you don't drink milk in excess. So if you drink milk in excess, you'll have high carbohydrate intake, which can cause you to have high triglycerides. That is the fat component in your blood that goes up when you eat too much carbohydrates. It's got a 2.1 risk factor for heart disease. So butter and fatty meat will let your cholesterol go up slightly. So that has a 1.6 risk factor for heart disease. But the other things that we are solving with the carnivore diet, like diabetes, has a 10.7 risk factor. Metabolic syndrome has a 6.0 risk factor. Obesity has a 3.9 risk factor for heart disease. Hypertension has a 4.5 risk factor for heart disease. Those are the things that we are solving with the carnivore diet. And I drink Bulletproof coffee every day. I'm not concerned for my cholesterol, because I know cholesterol is actually very good for you. Your skin or cell membranes are made from cholesterol. Your hormones are formed from cholesterol. 30% of your body's cholesterol is within your brain. Your brain manufactures all of that cholesterol by itself. Your immune system is enhanced with cholesterol. Your nerves are sheathed with myelin, which is formed from cholesterol. So cholesterol is not a bad thing. Of course, if you talk about excessive high volumes of cholesterol, then of course it can be problematic. I'm not a doctor. I'm not advising anyone to stop their medication. What I say is look at the information and the studies that was done. What are the real risks for heart disease, and discuss it with your doctor. There are, however, many people on this TikTok channel and YouTube channel that testify to the fact that their cholesterol actually improved on the carnivore diet. Why? Because, as I said, insulin resistance go away, and insulin resistance causes a lot of problems in the body, and you end up with high triglycerides. And many people testified that the LDL actually improved on the cholesterol panel, as well as the HDL went up. HDL is your good cholesterol, and there's a lot of studies that suggest that a low HDL is a cause of many diseases. So nobody talks about that. What about your good cholesterol? So insulin sensitivity, that is where I am. Everybody that is on the carnivore diet and follow it strictly are insulin sensitive. So insulin sensitivity is defined as having a high HDL, which is your good cholesterol, and low triglycerides. Triglycerides is the fat in the blood that goes up when you eat too much carbohydrates. So insulin resistance is defined as having a low HDL, the good cholesterol, and high triglycerides. LDL is not even a factor. We don't look at LDL. Your cholesterol is what your cholesterol should be. This is what my doctors say. Go and check it out on my blog. Don't believe me? listen to what my medical doctors say and discuss it with your own doctor.